Hey, welcome to Teaching Tuesday. I want to talk about something a little different this time. We talk about buttock augmentations all the time, and you don't hear much about butt implants anymore. So I wanted to bring up, what's the difference between butt augmentation with fat or Brazilian butt lift, right, and using implants. Well, implants were very popular at one time. One of the problems with implants is like you're putting it in by the anus, there's a much higher incidence of infection. When I say infection, 5-10%, that means the implant has to come out, right? So that's a failure of the procedure. And another problem is that you have an implant in a place where you sit. So if you have any discomfort from it, or you can have trauma to that area, that can cause problems forever. I had an implant in a girl once, and she went down a water slide like 5 years later, when you hit the bumps on the water slide, actually caused a fluid collection around her implant. 5 years, you think you're done, right? Okay, so those are the problems with butt implants. So we did a lot of fat grafting. And one of the problems with fat grafting, though, especially now when it's done in the safest way, not down in the muscle, you can only put so much fat in, right? It's nice because it's your fat, it's permanent. There's really nothing to worry about once it, at about 4 or 6 months, we know what we have, we know what survived, that's it, it's your fat, it's not going anywhere. But you can only fit so much in there. Turns out you can only fit such a certain size implant in there too. So both procedures are limited in size. But the one nice thing about doing fat grafting is you can always go back and do more and add more to the bigger buttocks, and I guess there's no end as long as you have enough fat to harvest. That's kind of how I look at buttock augmentations, and why I prefer fat grafting over the butt implants is really to minimize the complication risk, because it's not just around the time of the surgery, it's long term, it's for the life of the patient.